Jeremy, my name's Elena. I'm going to be your nurse that's going to be discharging you today. We're going to have a little chat for maybe about 15-20 minutes just about what discharge is going to look like and just explaining a few things for you to go home.
Yep.
Is there anyone that's going to be with you, or is it just going to be you going back to your house?
No, it's just me at my house, so it's just myself.
Okay, awesome. I'm wondering if you've been explained yet why you came to the hospital and what your diagnosis was.
Kind of, but I guess I don't fully understand. Yeah.
Okay. Yeah, so I'm just going to explain that to you quickly, and then I'm going to have you re-explain it back to me, just so I know that you kind of understand it, and if you have any questions throughout, just feel free to ask.
Okay.
Using the teach-back method is a great tool. We could start by using plain language to explain information, then ask the patient to explain what we just told them in their own words, re-explain anything that's misunderstood, and repeat those steps until we're in a firm understanding.
Sounds good.
So you have a condition called, or diagnosis, called biventricular heart failure. So in your heart, you basically have 4 chambers. So I can kind of draw it out for you here. So let's say this is your heart. Really doesn't look like that. I'm not an artist. So you kind of have 4 chambers. So these 2 are called the atrias, and these 2 are called the ventricles. So the ventricles are in the lower section.
Okay.
So in your specific type of heart failure, the 2 at the bottom, so the ventricles, we're having a bit of a difficult time pumping the blood in and out like they should. So basically what that does is it doesn't get all the oxygen and blood to your organs. So that's the anatomy side of it. Do you think you could teach that back to me?
I think so. So basically you said that my heart failure is when the bottom parts of my heart, which are called the ventricles, they aren't pumping blood to my organs, which is bad.
Mm-hmm. Yep. And can you point to where the ventricles are?
You said it's these 2 bottom ones.
Awesome, yeah. So, definitely not great, but it can cause different things in your body, which you ended up experiencing. So fluid buildup, which is called edema. So that's kind of when your legs were maybe a little bit puffy and you were feeling just a little bit heavy. That can make it harder to breathe, it can make you tired, and it can also cause you to be dizzy. Those 3 are more of the short-term effects. If you were to continue long-term effects without seeking any treatment, it could really disrupt your body's process, like breathing, going to the bathroom, and even your thinking can become more cloudy. Can you tell me what you got out of that information?
Yeah, okay. So my heart failure made my body full of fluid, which is what makes me feel dizzy. And then it also makes my legs big and swollen, and it also makes me super tired. And so if I don't seek treatment when I did, it could have been really bad. And my body would not be able to do things like breathing, going to the bathroom, or thinking.
Mm-hmm. Good job. So now that you have that down, do you have any other questions about your diagnosis?
I think I get the diagnosis, but how can I make sure this doesn't happen again then? Or make sure it doesn't get bad, especially since I'm gonna be on my own?
Yeah, so I'm glad you asked that. Part of this discharge process is going through those things. So I have 3 things that we can talk about that may help you just kind of have a smoother transition to home, and also just kind of prepare you and prevent this from happening again. So first we'll go over a diet, and then exercise, and what too much looks like, what not enough would look like. And then lastly, we'll talk about medications pertaining specifically to heart failure.
Okay.
Do you have a piece of paper or your phone that you could write some notes down to remember?
Yeah, I can write in my notes app on my phone.
Awesome. So first we're going to start off with a diet. The main thing that you're going to want to avoid is sodium. So it's good to have around 1.5 to 2 grams per day. You're not expected to know exactly how much you're taking, but it's important because sodium plays a big role in that fluid balance, which the problem was you had too much fluid in your body, and so we're trying to avoid that. So basically when sodium is in your body, water or fluid follows. So we're trying to kind of eliminate too much fluid being in there. So you don't have to track it to a T, but being cognizant of it is pretty important. So when you're picking up food from a grocery store or a restaurant, usually just in a grocery store, there should be a food label on the back of whatever you're buying. And usually somewhere around the middle of that food label, it would have a sodium number. So food label would be on the back, so like in a little box. So it has usually the calories up here, and then below it has a bunch of lines. and it just has like different types of things. So sodium would usually be in the bottom, so it would have like, let's say something had 150 milligrams of sodium. It'd be around there, and you're gonna look for sodium and look for it usually has milligrams. So you're wanting to aim for 1,500 to 2,000 milligrams a day of sodium.
Okay.
So just kind of keeping that in mind. There are some specific food items that have a lot of sodium, which you may want to avoid. So deli meat, pizza, burritos, tacos, soups, savory snacks like like popcorn and chips, and then also burgers and poultry. So there's a website I can give you on one of our pieces of paper that has a list of good low sodium meals and includes each category like fruits and veggies, grains, proteins that are good like eggs, fresh cuts of chicken and beef, fish, dried beans, dairy, and healthy fats like avocados, chia seeds, and nuts.
Mm-hmm.
Do you have any questions about the diet?
No, I think I understand for the most part. It's just, yeah, I would like that website on a piece of paper. Please.
Yeah, definitely. And then below that website, I can also kind of pull out the important information that you could just have with you.
Yes, that sounds perfect. So I can hang that up to my refrigerator. That'll remind me when I go shopping, just to take notice of these kind of things, which I haven't really before.
Yeah, that's a great idea. Are you ready to talk about exercise next?
Yeah.
Okay, perfect. So to start off, just so you know, regular exercise can help reduce the risk of something happening again. So like any type of heart disease, can strengthen your heart, improve that circulation through your body, and it can help you with your energy levels as well. So if you have any questions at any point, don't hesitate at all to call your doctor, your provider, to see how much is too much or not enough. And definitely that's a good thing to talk about at any appointments you have as well. So first you're going to want to start slow by gradually increasing your walking pace. So maybe you go to a slow walk, to a moderately, maybe even like a quicker paced walk depending on how you're feeling. If at any point you feel short of breath or you feel chest pain, stop right away and go back and rest. As the weeks go on, aim for about 30 to 45 minutes of walking a day. Even if you go for 10 minutes at a time, 2, 3, 4 times a day, that's perfect. I'd recommend walking in short distances close to home, so if you start to feel out of breath or in any pain, you can go home immediately and rest. Once you get walking under control and aren't having any issues, maybe move on to aerobic activities like stationary cycling, swimming, water aerobics. I've seen water aerobics be a great community with women your age who love exercising together. You get that social aspect. It's just a great thing to do. And if at any point during any exercise, including walking up the stairs, doing anything, you start to feel out of breath or have a super fast heart rate that doesn't go away in 15 minutes of rest, or any weakness or chest discomfort, call your doctor right away. Do you have any questions about exercise?
That sounds all good, but is there anything that should be completely off limits for me?
Really the only thing I would say that's super off limits would be heavy weightlifting or anything that makes you personally super out of breath or gives you any type of pain. But other than that, do you kind of understand what that would look like?
Yeah.
Okay. So next and finally onto our medications. Are you ready?
Yep, I'm good. So talk
Okay.
about the medications then.
Perfect. So I can also write you down a list of these, just kind of the important bullet point information that you can just have up in case of you forgetting or anything like that.
Okay.
So we're going to talk about 4 different medications that are specific to heart failure. If you want to take little notes on each drug, I will stop and ask you kind of what you wrote down, just so we're kind of in the same understanding. So first, we're going to talk about carvedilol. You're going to take this once a day, usually with breakfast. It's a pill that you'll swallow. The medicine slows down your heart rate if it's too high and lowers your blood pressure, which will help blood get to other parts of your body. You'll want to take it with meals. Don't take over-the-counter drugs with it. Normal side effects would be dizziness and lightheadedness, so be careful if you're driving or doing any dangerous activities. If you have any difficulty breathing, swelling of your legs or arms, extremities in general, if your stool or urine is a different color, or you have a slow heart rate, or a rapid change in your glucose, which I know you check because you are also a diabetic, report it to your doctor right away. So what do you have written down about carvedilol?
Okay, so I have that I should take it with a meal, like once a day, and that it is for lowering my heart rate and my blood pressure when it's too high or if it's too high, and that if it's normal if I'm dizzy or lightheaded, but I should call my doctor if I have shortness of breath or that swelling in my arms or legs, as well as super slow heart rate, change in my glucose level, or if my stool or urine is a different color than normal.
Yeah, that's awesome. I know it's a lot of information, which is kind of why I had you write it down, just so it's easier to remember, because I don't even think I would remember if I was given that much. So next we'll move on to lisinopril. You'll also take this once a day by swallowing a pill that you should take with meals. This also helps to lower your blood pressure and help treat heart failure by helping those ventricles pump blood more efficiently. So normal side effects would be a stomach ache, low appetite, change in taste, fast heart rate, dizziness, headache, sleepiness. Things you should report are mouth sores, sore throat, fever, the swelling of your hands or feet, a super irregular heart rate, chest pains, any swelling with your eyes, mouth, lips, or tongue, and any difficulty breathing. So what do you have written down for lisinopril?
So this one I got that I should take this once a day with a meal again, and that it's to help my heart failure. And normal side effects are upset stomach, no appetite, my heart rate is fast, a headache, and being tired or sleepy. But then I should report to my doctor if I have any swelling or sores with my face or mouth, if I'm having a hard time breathing, or if I have an irregular, like I feel like my heart is beating irregularly, or if I have any chest pains.
Yeah, that's awesome. Halfway there, next we'll talk about hydralazine. So this one you'll take 4 times a day as a pill. So you'd want to take this breakfast, lunch, between lunch and dinner, and then at dinner. This drug relaxes the smooth muscle in your heart's a smooth muscle, so it would relax that, which causes less chest pain. It also decreases your blood pressure. It would be important to check your blood pressure each morning, and if it's lower than normal, then call your provider or your doctor to see if you should continue taking these drugs. But the important thing is to not stop them abruptly. So normal side effects would include a headache, fast heart rate, joint and muscle pain, and ones that you should report is a super fast heart rate, any chest pain or pressure, swelling in anything below your knees, dizziness or fainting, shortness of breath, or any type of rash. What do you have written down for this one?
So for this one, I should take this one 4 times a day with all my meals and then at night as well. And that I should report super fast heartbeats, if I have any chest pain or swelling in my legs, or if I have shortness of breath or rash again. And I shouldn't stop this drug abruptly. And if my blood pressure is low, I should call my provider to see what they want me to do.
Yeah, awesome. So one more, torsemide. This one will be taken twice a day, once in the morning with breakfast, and with the other medications in the second dose around 2 or 3. If you take it too close to nighttime, you'll end up having to get up in the middle of the night to use the bathroom. Torsemide is what we call a diuretic. So basically it takes that extra fluid buildup anywhere around your body and excretes it through your urine. So if there's too much fluid, then you'll end up having to go to the bathroom a lot. What's super important with this drug is that you weigh yourself on a regular basis at the same time every day with the same clothing. I would recommend putting a weight scale in your bathroom. So when you wake up for the day, go use the bathroom and weigh yourself right after. I would even keep a chart in there as well to write it down, because it's kind of difficult to remember when you're waking up in the morning. If you gain or lose 3 pounds in a day, report it right away. You may also notice that your blood glucose levels may rise at the beginning of you taking this, which is normal. Some of the things you should report are unusual bleeding or bruising, trembling, fatigue, and muscle cramps. Anything written down for this one?
Okay. So for this one, torsemide, it'll make me need to urinate, so I should take it in the breakfast and at 2 to 3, and I should I'll take it in the morning because if I take it at night, it'll make me want to use the bathroom. It'll wake me up. And that I should weigh myself every morning and then report if I gain or lose 3 pounds. But I should also report if I am bleeding or if I have bruises forming, if I'm shaking, tired, or have any muscle cramps.
Yeah. So I think after all that, you are good to be discharged. Do you have any questions at all before you're able to leave?
No, I think I'm good. Thank you for all the information and allowing me to write this all down so I can take it with me to go home.
Yeah, definitely. Well, that's it for me today. Thanks for your time.
Thank you.
And I would exit the room. So as a nurse, I answered a few of the questions, but one to point out specifically, I prescribed my patient a low sodium diet, and I knew to choose this since the patient had fluid overload. And although in the lab value the sodium level was low, I know that was because there was so much fluid in the patient's body that the sodium was diluted. But I also know, like I said earlier, that when there's sodium in someone's system or in their body, the fluid follows, which was the initial problem before the sodium was diluted. So low sodium diet for a heart failure patient has been proven to work, and most of my sources that I put in here prove that.
And then as the client, I was able to ask myself, do I know precisely what is meant by this, by my diagnosis? So I have biventricular heart failure, and I know that it means my ventricles aren't pumping blood into my body like it should be, so it's causing a fluid overload and a lack of perfusion to other parts of my body, giving me the swelling, edema, making it hard for me to breathe, and then also making me dizzy and confused.
Okay,